I personally don't take a lot of medications, but my mom does these days. So I'm very interested to hear what they have to say. Whether you take one prescription drug or many, have you ever considered compounding? We are so happy this morning to welcome Dr. Himanshu Patel, his wife Priya Patel, and they have Medicine Counter Pharmacy.
Yes.
Good to see you.
Good to see you too, and thank you for having us today.
So this is really interesting, and I'll let you kind of take our conversation in various ways, but I always thought that compounding was just a different way of taking a normal medication and bottling it. But as I understand it from you, this is for people who have a prescription they need to take, but it's not effective really.
Right.
When you compound it, that can make all the difference.
Right, so that's correct. So custom compounding is for individual patients' need when they're not being benefited from commercially available medications or dosage form, or they're having side effects from current prescription drugs that's commercially available. Their doctor can, or it's not working, their doctors can decide whether they want to try compounding, and a lot of patients have benefited from going that route as well.
Okay, so you are obviously a local business, so you work very hard to keep the pricing down, because I would think a lot of people might think, yeah, but to get that, is my insurance still going to cover it?
So currently a lot of insurance don't cover compounding, but most patient pays around $30 to $60 a month for their compound, so it's pretty affordable these days.
Okay.
And we keep the price lower to make sure that patient can afford it as well.
I know you're very proud of that fact.
Yes.
So Priya, earlier we were talking and I asked you if people ever have these health benefits from it where they had almost given up on the prescription working, and before I could get the question asked, you were already nodding your head.
Yes, so depending on what it is for, so let's see, perhaps if it's for arthritis or some kind of pain, and they have been taking orally medication that the doctor prescribed and it's not working, what we can do is if they're having side effect by taking it orally, we can make a cream. And then, they can apply the cream to localized area like knees or shoulder or back pain, and that can benefit. We have a lot of patients and it has worked great, so yeah.
Does it, one of the frustrating things when you're taking prescriptions is that if you have one that's not effective, you have to give it a certain length of time and then go back to your doctor and, well, now let's try this one. And in the meantime, time is going by and you're not feeling very good.
Right.
When you try the compounding, if it's going to have the benefit, do you see it pretty quickly?
Yes, so normally within like 30 minutes, you start to feel pain relief when you apply it, yes, because it gets absorbed pretty quick. But the full benefit is normally seen after a few days because the drug levels will get built up in your tissues where it will help you with pain relief better and inflammation as well.
What about the fact that not all compounding involves a cream?
Right.
Yes.
But when it does, if you are taking an oral medication and it either says, take with food or wait 1 hour after breakfast or something, do you have to follow the same protocol when it's a cream?
No, when it's a cream, you don't have to worry about when you eat or when you don't, because it's not going through your GI system, gastrointestinal system, so you don't have to follow those restrictions because those medications are not going through your gut.
So that frees up a lot of people then with just how they manage their day.
Right.
Does it not?
That's correct, yes. And a lot of anti-inflammatory medications can cause stomach ulcers and also has kidney damage and heart damage issues, right? Like anti-inflammatories such as ibuprofen, naproxen, Aleve, Motrin, all of those medications, if you take it for long term, it's not healthy. When it comes to cream, it's just we are applying localized on certain areas where you have pain or inflammation or pain due to inflammation, and when you apply that way, it's not going through your stomach and kidneys, so it wouldn't damage them.
Are you suggesting then that you can do a compounding of something that you could otherwise buy over the counter?
Right, that's correct.
So for runners in town or something like that where they're using it?
For a lot of health conditions such as back pain, plantar fasciitis, migraines,
fibromyalgia,
neuropathy. Yes.
Yeah.
Wow.
Yes.
Now, is it perhaps a dumb question, but is it simply for pain relief that you can compound?
No.
Can you compound other types
Yeah,
of medications?
we can compound for a lot of health conditions such as dermatology conditions, right? We compound,
Hormones.
yes, hormone replacement therapy.
That's right. You were talking about that for postmenopausal women. I'll
Yes.
put you in the hot seat. Pardon
Right.
the fun.
So, you know, when your hormones are abnormal compared to somebody who is not going through menopause and the levels of hormones are normal, right?
Right.
So you'll go through side effects such as hot flashes, right? Night sweats, mood swings, and due to all of those symptoms and hair loss, right? So doctors can check your levels on your, female hormones, and there are 3 or 4 different types of female hormone, and based on your lab work, doctors can decide how much of which hormone do we need to put in your compounds, whether it's cream, a hormone replacement therapy cream, or troche, which is the sublingual little candies that you put it under your tongue and you let it dissolve, and whether it's capsule, we can do it all 3 different ways.
So do you get the lab work sent to you and then you know how to create?
No, doctor normally decides that at this time, but we have some pharmacists in other pharmacy who's already been trained to do that as well. But that's something we consider doing that in future. Yes.
Okay, I thought this was really great too. So over the years, our old druggist left, but we had developed quite a close relationship with him, and it was such a peace of mind because my kids could get sick and I could just pick up the phone and call.
Right.
And you become part psychologist, part pharmacist, part friend, right?
Right.
So you recognize the need for that relationship. Y'all also deliver, is that right?
So
Yes.
we offer free delivery within 10-minute radius, which covers like 10 to 15 miles from pharmacy.
Okay.
And we also sync up your scripts, so you don't have to make multiple trips a month to pick up your scripts. So once we sync your scripts and your prescriptions, then we fill all your prescription one day every month, and we offer free delivery. That way you have every single medication you take every month, and you don't even have to go to pharmacy if you choose not to go to pharmacy.
That's great for people
Yes.
either who have a really strong health issue that makes it difficult for them to get out of the house, or if your kids live away and you're aging. Okay, something else you do, and I almost forgot to touch on this, is this thing called, is it bubble packaging?
Right.
Yes.
So
This is fascinating.
So we call it adherence packaging, which improves
Adherence?
Adherence, yes. So that basically is weekly multi-dose packaging. They would get 1 pack every week, and they would have 4 different slots for the day. And if they take it 4 times a day, now if they take it just 2 times a day, then we can just fill
2
it
times
as
a day,
just 2 slots a day. And all their medication, today is Thursday morning, so they just look at the bubble pack, and they would have a label on each bubble, and it would be their name, their medications on there, and the time and day, and all they do is just pop the bubble, take the medication, and that's it.
So you have a visual. We've all, I don't care if you're in your 20s, you've had this experience where you've had to take something and you forget, wait, did I take it today?
Yes.
You've popped the bubble.
Yeah.
Right.
And
So
if
you know
you're
you took it.
traveling, if you're working, you don't have to take bottles with you. You just take that day, like let's say this morning, you take that little bubble with you, you come to the work, you take it at lunchtime.
Okay, let me get you to them. It is called Medicine Counter Pharmacy. They're in the Gad Road Shopping Center on Highway 153 in Hickson. 680-7373 is their phone number. Thank you so
All right.
much.
Thank you for having us
Yes,
today.
thank you.